The urinary system. This diagram shows the parts and the structure of the urinary system. The second diagram shows just like that. Urinary system consists of two kidneys, two ureters, the urinary bladder, the urethra. Major functions: excretion of wastes, hormonal production, renin and erythropoietin, acid-base balance, filters blood plasma, regulates blood volume and pressure, gluconeogenesis. Anatomy of the kidney is on this diagram. Kidneys: a pair of reddish brown bean-shaped organs are retroperitoneal in the posterior abdominal region, lateral to the vertebral column, lie in the extraperitoneal connective tissue, extend from TV XII up to LVII in supine position. Right kidney somewhat lower than the left kidney, longer and more slender organ than the right kidney, and nearer to the midline. Adult kidney is 10 to 12 centimeter long, 5 to 7 centimeter wide, and 3 centimeter thick. Weighs 135 up to 150 gram. Relationships to the two other structure. Anterior surface of the right kidney, superior pole covered by the right suprarenal gland, small area. The liver, large part, medially related to descending second part of the duodenum. Inferior pole, laterally directly associated with the right colic flexure, medially covered by a segment of the small intestine. Of the left kidney, superior pole covered by the left suprarenal gland, stomach and spleen, mid part covered by pancreas, inferior pole laterally left colic flexure, and the beginning of the descending colon, medially covered by a segment of the duodenum. Look the diagram. Posteriorly, both are related to similar structures. Superiorly is the diaphragm. Inferior to diaphragm are psoas major, quadratus lumborum, and transversus abdominis muscles. Superior pole of the right kidney is anterior to rib XII. Of the left kidney is anterior to ribs XI and XII. Passing posterior to the kidneys are the subcostal vessels and nerves, the ilio-hypogastric and ilio-inguinal nerves. Look at the diagram. Renal fat and fascia encloses the kidneys. Renal capsule encloses kidney-like cell phone wrap, continuous with the outer coat of the ureter, serves as a barrier against trauma and helps maintain the shape of the kidney. Perinephric fat or perirenal fat is outside the renal capsule, is an accumulation of extraperitoneal fat, completely surrounds the kidney. Renal fascia encloses the perinephric fat, is a membranous condensation of the extraperitoneal fascia. Look at the diagram. Hilum of the kidney. On the medial margin of each kidney is a deep vertical slit through which renal vessels, lymphatics, and the nerves enter and leave the kidney internally, continues with the renal sinus. Perinephric fat continues into the hilum and the sinus and surrounds all structures. Here is this diagram. Internal anatomy of the kidney. Renal cortex is a continuous band of pale tissue. A superficial light red area completely surrounds the renal medulla. Renal columns are extensions of the renal cortex, project into the inner aspect of the kidney, dividing the renal medulla into discontinuous aggregations of triangular shaped tissue. The pyramids. Renal pyramids. Their bases are directed outward toward the renal cortex. Their apex or renal papilla projects inward towards the renal sinus. Each renal papilla is surrounded by a mirror calyx. Mirror calyces receive urine, representing the proximal parts of the tube that form the ureter. Unite to form a major calyx. Each kidney has 8 to 18 mirror calyces and 2 or 3 major calyces. A minor calyx receives urine from the papillary ducts of one renal papilla. Major calyx 2 or 3 major calyces unite to form the renal pelvis, the funnel-shaped superior end of the ureters. Renal pelvis formed by condensation of 2 or 3 major calyces narrows as it passes inferiorly through the hilum, continues with the ureter at the uretero-pelvic junction. Here is the diagram. Lobe of kidney is look like this diagram. Consists of 2 parts: renal corpuscle or body, where blood plasma is filtered within the renal cortex. Components: glomerulus capillary network, glomerular Bowman's capsule, a double-walled cavity between the 2 layers that receives filtrate from the capillaries. This is microscopic structure of the kidney. The nephrons is the functional unit of the kidney, more than 1 million nephrons. Renal tubule in which the filtered fluid passes consists of 1 proximal convoluted tubule attached to the glomerular capsule within the renal cortex. Second, nephron lobe of Henle. 3 distal convoluted tubule DCT empty into a single collecting duct. Collecting ducts unite and converge to form large papillary ducts which drain into the minor calyces, are not part of the nephron. Look at the diagram is look like this. Glomerular or Bowman's capsule consists of visceral and parietal layers. Visceral layers consist of modified simple squamous epithelial cells called podocytes. Their cells wrap around the single endothelial cell layer of the glomerular capillaries, forms the inner wall of the capsule. Parietal layer consists of simple squamous epithelium, forms the outer wall of the capsule. Capsular space or Bowman's space between the 2 layers of the glomerular glomerular capsule receives fluid filtered from the glomerular capillaries. The diagram looks like this. Juxta glomerular apparatus GGA, specialized organ near the glomerulus of each neuron, where the distal tubule lies against the afferent or sometimes efferent arteriole. GJGA is formed by three different structures: Juta glomerular JG cells in the wall of afferent arteriole, some in efferent arterioles. Enlarged smooth muscle cells. Enlarged smooth muscle cells produce hormone renin, act as mechanoreceptor. Here is its diagram. Mesangial cells found in the triangle bound by afferent arteriole. Efferent arteriole and the macula densa have phagocytic and contractile properties, influence capillary filtration. Macula densa, specialized epithelial cell, tall, closely packed in the initial portion of distal tubule cell, lie adjacent to JG cells, function as chemoreceptors or osmoreceptors. Here is fluid flow through the nephron. Capillary endothelium of glomerulus is fused with epithelium of the Bowman's capsule. Fluid filtering out of capillaries goes directly into tubule. Glomerulus plus Bowman's capsule. Glomerulus plus Bowman's capsule equals to renal corpuscle. Bowman's capsule, proximal tubule, lobe of Henle, descending lobe, fluid to medulla. Renal pelvis, then collecting duct, distal tubule, ascending lobe, fluid to cortex. Renal pelvis, urine. Distal tubule, close proximity to afferent and efferent arterioles. Paracrine communication. The diagram looks like this. Renal blood vessels. Arterial blood enters the kidney through the renal artery. Blood drainage. Renal veins to inferior vena cava. Here is the diagram. Second diagram. The collecting tubules enter the renal medulla, renal papilla, minor calyx, major calyx, renal pelvis, ureter, urethra. Ureters. The tubular organ, 25 centimeters long each, retroperitoneal, extend from the renal pelvis to the bladder, thickest near its entry into the bladder, conduct urine to the urinary bladder, has three coats or layers. Mucosa, deepest mucous, membrane coat, epithelium, traditional epithelium, lamina propria, underlying of areolar connective tissue, contain collagen, elastic fibers, and lymphatic tissue. Muscularis, throughout the length of the ureters, smooth muscle fibers. Its major function is peristalsis. Adventitia, superficial coat of the ureters, layer of areolar connective tissue containing blood vessels, lymphatic vessels, and nerves. The diagram just look like this. Second diagram. Urinary bladder is a hollow, distensible muscular organ. Its shape depends on how much urine it contains. Capacity average 700 up to 800 ml. A storage sac for urine. Urethra exits at the neck, supplied by sympathetic and parasympathetic innervations. It is smaller in females because the ureter occupies the space just superior to it, situated in the pelvic cavity, posterior to the pubic symphysis. In males, it is anterior to the rectum. In females, anterior to the vagina and inferior to the uterus. Wall of the urinary bladder, mucosa, a mucous membrane composed of traditional epithelium plus an underlying lamina propria. Rugage folds in the rugia folds in the mucosa muscularis, intermediate layer surrounding the mucosa, detrusor muscle, adventitia, most superficial coat, areolar connective tissue that is continuous with that of the ureters, just like this diagram. Second diagram. Urethra, tubular, conveys urine to outside. Its wall contains mucus secreting urethral glands. Begins at the base of the bladder, ends with an external opening in the perineum. Paths differ significantly in women and men. In women, is short, about 4 cm long, travels slightly curved course, open anterior to the vaginal opening in the vestibule between the labia minora, the para-urethral glands or Scans glands, two small mucous glands homologous to the prostate are associated with the lower end of the urethra. The diagram is just like this. In men, long about 20 cm, divided into pre-prostatic, prostatic, membranous, and spongy parts. Pre-prostatic part, intramural, is about 1 cm long from the base of the bladder to the prostate, is associated with internal urethral sphincter, prevents retrograde movement of semen. Prostatic part is 3 to 4 cm long, and the widest part, surrounded by the prostate, is where the urinary and reproductive tract is connected. The diagram is just like this. Membranous part is narrow and passes through the deep perineal patch surrounded by external urethral sphincter. Spongy urethra is surrounded by erectile tissue, the corpus spongiosum. Two bulbourethral glands open into it. This is just like the diagram.